So we're always dividing everything into high yield and low yield. So for my experience, as soon as I think something is low yield, I know I'm not gonna learn it. And that's because one day I decided to say, okay, everything high yield. And that's how I studied for step one, step two, and step three. For me, everything was high yield. Never divided anything into either high yield or low yield. I just learned everything I could. I just tried to make everything as smooth and as easy as possible. So if I have one rule that you guys should take home with you is don't be dividing things up because you are pretty much telling your brain, okay, there's no reason to learn this. But then the exam is all about. Let me mute everybody here real quick. One second. I'm just gonna mute everyone because I keep hearing two people. So anyway, so from my experience, because the step is points, every single point matter, it's always good to take every one little point, and you're gonna have questions that you not consider high yield, but if you have it wrong, then you have a point less or a few points less. So in the exam, the real deal, everything is high yield. Can you guys still hear me? I think I muted everyone and I don't hear anybody now, but can you guys hear me? Okay. Anyway, sorry, trying to figure out the technology. Okay, so my rule number one for everything that I talk about today is that please don't divide everything into either high yield or low yield. Just learn everything you can because at the end, if you have 300 questions, the more you get right, the best. And like I just said, not everything in the test is what you would consider high yield. There's also some low yield questions that if you get right, that's good. But then if you didn't put the effort to learn it because you thought it was low yield, then you may get that question wrong. So again, everything is high yield. So a little bit about me. So like I said, I'm from Maracaibo. I went to Luz, La Universidad del Zulia for 2 years, but I moved to the US. I came to the US to play baseball and I did psychology while I played baseball. And then I still wanted to do med school. So I went to a school in Aruba. It's called Orios University. In that school, we do 2 years in the island. So I spent 2 years doing the theory, what is tested for step one. I did it in Aruba, and then I went to do rotations in Baltimore. And in Baltimore, I met some people, and I was able to do some research in Johns Hopkins and Sinai Hospital. I have already taken step one, step two, CK, CS, and step three. And like I said, I'm matching general surgery in New York. So I think I have a little background to give you guys some good advice. So moving on. So how did I study for steps? So I was talking to one of you guys the other day, and I said that I created these 4 Ws to try to learn everything. And I divided into what, when, where, and why. And the most important thing is always the why, because every question in the step is about the why. Why is this happening? Why is the patient having congestive heart failure? Why are we giving the patient a diuretic, furosemide, for heart failure? Or why are we giving this patient Milrinone for heart failure? So if you can answer the why, you can pretty much know that you know the concept. So when I was studying, I always used these 4 questions to know if I knew what I needed to know about each topic or each system. So what is being affected? The heart, the kidneys. Then when, that's important too, because sometimes your heart is affected when you're on exertion, and then that changes the diagnosis of if it was at rest. So if it's at rest, it's unstable angina versus if it's when you're doing exertion, is unstable angina. So when it's important también. Where is also important, and like I said, why is always the most important. So every time I study for step 1, 2, and 3, these were the 4 questions that I always asked myself. And if I could answer each one of those questions, then I knew I had a good understanding of the disease or the pharmacology or the biochemistry, any topic. It works for any topic. So for resources, I will say that I did not use UWorld for step 1. I used it for step 2 and step 3. But for step 1, I really didn't like to do questions, so I actually took step 1 without doing questions. I just read Patoma, watched the videos, read Gojan, and all these books here. Also, I never use first aid because I really don't like learning from bullet points, and what I've noticed from 4 years of med school, and I bought first aid like it's 2018 now, so I bought 2018, 17, 16, 14. So first aid for me has become just a mnemonic book, and I don't use mnemonics much. So for me, first aid didn't work, so I use everything else. But because it's the book that everybody uses, I cannot say don't use it. But personally, from my experience, everything above first aid is good enough. And honestly, if I was asked what is the one resource that everybody should use, it would be Kaplan for step 1, 2, and 3, and then UWorld for step 1, 2, and 3. Even though I didn't use UWorld for step 1, I'm pretty sure I would have done a lot better if I did, but that's in the past. Pathoma is very, very good. And Goljan, this guy has some audios that are really, really good too. He has some key points that are good to know. Physiology, as you will see in the slides, is the most important topic. You have to know everything about everything in physiology. I actually did a breakdown of important things for each topic that we will see coming up. But for physiology, I actually put you have to know it all because a lot of questions are physiology. You cannot go to any step if you don't know your physiology, especially for the heart, for the lungs, and for the kidneys, because that's going to be at least 50% of your test, which is good. Now that I think retrospectively, I think it's good that most questions focus on certain systems, because then persons like me can tell you, oh, hey, the step is going to be a lot of cardiology, a lot of pneumonology, and a lot of nephrology. So you guys can actually focus on that because you have some advice. And it's always good when they only focus on certain questions. So a newer resource that has come out to the market is called Ambos. I'm actually a medical writer for this company. I work for this company and it's amazing. It's like combining UWorld, Patoma, and pretty much every QBank together and making it in one website. So instead of have to go to UpToDate to look for information, if you go to ambos.com, there's a 14-day trial, and I'm sure you will like it. I wish I would have had it for step 1, 2, and 3, and I would have used that for pretty much all the steps because it's really complete and it's becoming really famous within American schools. Even American schools are using it, so you can go ahead and register for the free trial. If you guys like it, because I work with it, I can try to find, they offer some packages that are for groups. So instead of everyone having to pay a certain amount of money for an individual package, you guys can let me know and I can talk to them to see which kind of deals for group packages. And then as a group, you guys can enter, and they have question banks, they have everything. It is really good. But don't go to the step without. So for Kaplan, I think physiology is good. And if you guys are watching videos for Kaplan, look for the one. Don't use the ones for Conrad Fisher that are on the green screen because that guy is crazy and he's making more jokes than teaching. But there's this guy. His name is Wilson. He's an older guy, bald. It's amazing. Pretty much everything he says is a question in the steps. So I know I had a big, when I had Kaplan, I used his videos for physiology. But Dr. Wilson is the guy to go for physiology because the other videos are made by Conrad Fisher and I watch his videos, but I don't really like him as much as I like Dr. Wilson. But the Kaplan book is also very complete. So if you want to use a first source, like your to-go source, I will use Kaplan. I use Kaplan for step 1, 2, and 3 too. The only thing I didn't use for step 1 was Uwer. But everything else here I use for step 1. But my favorite was always Kaplan. Even when I was reviewing like the week before the test, I used Kaplan. The only one I would recommend that Kaplan is not as good is pathology. For pathology, I like Pat Thomas. Pat Thomas has some videos. And Goljan. The Goljan book is a little long, but he has really good integrations with pharmacology and physiology. So reading Goljan is almost like having a compendium of all the courses that go for step 1. The only thing is that all these books are only for step 1. Only Kaplan and First Aid and Uwer apply for step 2 and 3. But I would say that for step 1, 90% of my studying was Kaplan, and that was enough. But I did do BRS physiology because I really wanted to get a good understanding, and Goljan and Pat Thomas. So I first read the Kaplan books once. And I actually took the course. My school paid for the course that is 7 weeks, I think. So I did the 7-week course, and after reading the books once, I used the courses like people use the video, which is to take notes over the book of things that are not said in the book from the courses. Then Pat Thomas, I use the book and I use the videos together at the same time. Kaplan QBank, it's okay, because if you look at the dates for certain questions, they're out of date. They still have questions from like 2012, 2013, which for step 1 is okay, but for step 2 and 3, when you are doing medications and you have some criteria and guidelines, step 2 and 3 for Kaplan, if you are reading a guideline from 2012, and the guideline changed in 2015, then you will be out of date. And the best example for that is the guidelines for cervical cancer screening for Pap smear. That I think that changed in 2013, and some of the Kaplan questions are from 2012. So if you're learning those guidelines that are outdated, then you may get it wrong in the test. But I literally only use one QBank, which is Uwer. I think you can pass all the steps just with Uwer. Like literally, you don't need Pat Thomas, Goljan, or BRS or anything. Those are complements. But the bread and butter for all the steps is Uwer. For step 2 and 3, I did Uwer twice, so I did 2 rounds. For step 1, like I said, I didn't do it. But everything else, because step 1 is always the hardest because you haven't gotten exposure. Once you take step 1 and you go to step 2 and step 3, you get the hang of it, so you're not as scared, you're not as nervous, and you have a better idea on how to study and what to use, because when you come out of step 1, then you know, okay, I did, let's say, Goljan for nothing because everything I learned was in Kaplan. So then you decide, okay, for step 2, I'm only going to use Kaplan and Uwer. I'm not going to try to use a million other books available out there. So those are the main ones for step 1. For step 2, like I said, we use Kaplan and Uwer. And honestly, you don't need anything else. There's a million books out there like Step Up to Medicine and other things like that. I don't think they are going to add anything that you wouldn't get from Kaplan or Uwer. So moving on. So some things that I learned when I was in med school, because my med school was Goljan, I did the books and I did the audios. I actually always listened to Goljan's audios when I went to the gym, and then that helped me too. But the book is very complete, and because Goljan has been doing pathology reviews for so long, the exact words he uses in the book is literally the same way they put the answer choices in the step. And I will show you that in another slide that I have regarding language and some things that we need to focus on regarding language. So some pearls that I learned through my process is that if you create your own questions, it's going to help you a lot, because we are used to just answering the questions. But if you start creating the question, let's say you go to the Kaplan book and you look for, I don't know, let's say congestive heart failure, and you start reading, and from the content you make a question, like if it was a step question. So for example, congestive heart failure is a disease that you see in people over 40. I mean, rarely you will see somebody below that age, so in average. So you can start your vignette saying, okay, a 56-year-old male who has history of diabetes, and you start putting a picture together in the form of a question. Then it becomes easier, because when you're in the step and you're reading the question, you think as the question writer. Because in this exam, there's two phases. There is the question writer and what he's testing, and there is the student, us, the test taker, and what we are thinking should be the right answer. But we're biased because we always want to pick the answer that we think is right. But when you think as the question writer, then you get a different perspective. Because, for example, if I tell you I have a patient with PE, okay, so a PE patient has to have tachycardia before you pick PE. You cannot pick in any step. If you have a patient who sounds and smells and behaves like a pulmonary embolism, and that patient doesn't have tachycardia, you have to question your diagnosis, because one of the, is not a criteria, but one of the things, if you do 50 questions of pulmonary embolism, 49 will have tachycardia. So that gives you that perspective, because in step, every question sounds the same. Every question can be an MI, or an inferior wall MI, or a right-sided MI, or a PE, or a pneumothorax. Those are the things that are confusing because they are similar in a way, of course. But if you see, if I give you a vignette of each one of those, and one patient has tachycardia, that's the one with the pulmonary embolism, because you will see it in every question. So when you start writing questions yourself, you start seeing things from another perspective. Like, oh, okay, if they want me to pick sickle cell anemia or thalassemia, the first thing that you will see in the vignette is a African American boy, or you will see a 4-year-old boy from Egypt, or from one of those Mediterranean countries. So once you're writing the questions, you start seeing things that you would normally not see, because then you start dividing the questions and it makes sense. Also, create your own diagrams. I mean, that's all I did during my studying. Create diagrams, because what you write and what you create, you don't forget. It's like music. If you write a song, or if you compose a song, you don't forget it because you wrote it. So these two things I learned in school, in med school, and they help me a lot. And seeing questions after you create questions is really good. And I have a couple examples coming. And the other thing that I was actually discussing in the group a couple days ago is always ask when you're doing a question. So I know a lot of people wants to do 3 blocks in a day. Okay, I'm gonna do 3 blocks in a day, but then you're rushing. And when you're rushing, for example, you cannot ask this question that I will show you in the next slide. What else can they ask me about this topic? That's very important, because then I can give you the same question, the same vignette, a 50-year-old male with congestive heart failure. I can give you the same exact thing 7 times, and the only thing that will change is the final question. I can ask you what is the diagnosis, or what is the mechanism of this disease, or what's the treatment, or what's the complication, what's the physical finding. So when you take one question and from one vignette, you are able to come up with 5 other different things that they can ask you, then you're integrating. You are actually studying better than just going through 3 blocks in a day and not seeing what else. There's always something else that they can ask you, and there's always something that you can learn about that topic. Another thing that I also mentioned in the group earlier is you have to find the way is best for you. So for example, the way that worked for me was this. Instead of doing 3 blocks every day, I'd rather do one block and try to see what else they can ask me in a question. So for example, if at the end I come up with 5 other questions in one question, that is 6 questions. So if I do a block of 40 and I'm coming up with 4 or 5 questions, I'm pretty much multiplying my question just by trying to find other things that are related to the topic that they can ask me. And the other one is that you don't want to go with a million resources. Even though here I put 1, 2, 3, 4, 5, 6, you want to pick the 2 that you like or the 3 that you like, and you want to stick to it. Because if you start reading different books, then you're going to start getting confused, and some books say things that are different. So you don't want to get caught up into, oh, this one said this and then the other one said that, because then you get confused. So I put one example about this important question. What else can they ask me about this topic? So I'm not going to go through this whole question. It's actually this one. But I'm going to tell you, this question is a patient with atrial fibrillation. So I guess we can use this question a little bit to discuss how to go about the question. So you expect a patient with atrial fibrillation to be older, because that's just the pathophysiology of the disease. So a 56-year-old man. So if you start writing your own questions, you're never going to write a question that is a 10-year-old boy with atrial fibrillation, because that makes no sense. So you expect the patient to also have some palpitations, tachycardia, and things like that. So in this whole question, all you need to read to get the question right is fast heartbeat, very irregular, and then your heart rate. This is all consistent with that. And the question, look at the question, which of the following ECG findings is most likely in this patient? So the answer is absent P wave. But if you use this method of actually, what else can they ask me about this topic? Then you can ask yourself, okay, so what else can they ask me about atrial fibrillation? So for step 1, they can ask me some anatomy. They can ask some, like, where is the atrial fibrillation originating from, where in the atrium, the sinoatrial node, things like that. But they can also ask you something like this. They can ask you, which of the following findings would you see, for example, in the venous pulse tracing? And if you don't think about that ahead of time, then it can catch you off guard. But if you go to Kaplan, I took this from Kaplan, the A wave is accent in atrial fibrillation. So that can be a question. They can give you this same vignette, nothing changes. And this question at the end can be, what would you see in the jugular venous tracing? Or they can put a graph, and they can put this graph with all the variants. So you would expect the A wave to be flat. And that would be the right answer. But if you don't think about that ahead of time, first it's going to take you time in the test to think about it, because then you have to reason it. But if you ask yourself with every question you work on, then you are able to come up with better things. And it's easier when you go to the test, it's already in your mind, so you don't have to waste so much time. But I personally think this is valid because it is true. I mean, Kaplan says it. So then you don't have to go to a million books to know that the A wave in the jugular venous tracing is absent in atrial fibrillation, because you're going to find this in every single book the same way. And that's one way that you can ask yourself, okay, so how else can they ask me this question? Here they just ask for the EKG. For step 2, they can give you this same vignette, and they can ask you which of the following would be the best step in management. And then you have to see, okay, if the patient is stable, you can do rhythm control or heart rate control, so beta blocker, calcium channel blocker, etc. But if the patient is unstable and he is dizzy or he's about to pass out, then you have to cardiovert. So this is also how you can integrate step 1 with step 2 and with step 3 things. Another important thing is to understand and to be able to translate certain things. So this question is about microbiology, because we're not doing like a review of questions and not reading it, but I want you to actually pay attention to what they're giving you. They're giving you non-lactose fermented gram-negative rod on McConkey agar. So if you don't know which organisms are non-lactose fermenting gram-negative rod and Agrobacterium agar, you won't know this answer. And they will give you a list of organisms, but if you don't know who does this, then you wouldn't know which organism to pick. It would become a guessing game. So this I also took from Kaplan. Well, actually, this is the graph from the answer. But these are things that you have to know. So we cannot only learn, okay, Klebsiella is a gram-negative, E. coli is a gram-negative, they cause diarrhea, bloody diarrhea, because those are basic things. But the questions are going to have, inside the question, they're going to have all these features, lactose fermenter versus non-lactose fermenter. They're going to tell you if it grows or not in MacConkey agar, and they're going to tell you if it's oxidase positive or negative. So that's one way that they can say it. So they can give you that in the vignette, like here. They gave you that here, but they may take that out, and that's why it's important to say, okay, what else can they ask me? Because instead of asking you this, they can just tell you about the diarrhea, and they can put a list of bacteria. So they can give you Klebsiella, E. coli, Enterobacter, and Pseudomonas, for example. But another way that they could put those answer choices for you to pick would be, okay, let's say they want you to pick Pseudomonas. So instead of just telling you Pseudomonas, they would tell you it's a gram-negative rod that grows on MacConkey agar, it's a non-lactose fermenter, oxidase positive organism. And that will be written here as an answer choice. And that will be the right choice. So it's very important to always know how to translate things. And we will see that in pathology a lot too, and I have some examples coming up too. So if you go to Kaplan again, because I said that that's a really good source to go for, here is the graph that they have in the book. So they don't have to tell you Staphylococcus aureus for you to pick Staphylococcus aureus. They can tell you it's a gram-positive cocci that is catalase positive and coagulase positive. And that is equal to Staphylococcus aureus. So that can be written in the question stem, but that can also be written in the answer choices. So that's why I personally think it's a really good technique to write questions, because you can write a question. Okay, if I want to make a vignette with Staphylococcus aureus, let's say it's a patient who ingested a 10-year-old man who went camping and he had some salad. And let's say it's the Staphylococcus aureus toxin. So then they would tell you something like, the organism is which of the following organisms is the causative agents for this patient? And they will not tell you Staphylococcus aureus, they would tell you a gram-positive cocci who is catalase positive, coagulase negative, etc. So it's important to understand and to be able to translate. Okay, Staphylococcus does this and this and this. It grows here, or it doesn't grow there, or is sensitive to novomycin, or is not, or is resistant, because that's how the answers are going to be. Because if they just put Staph aureus, it's too easy. Everybody will get 270, 280 in the step. So that makes a big difference, and that applies for everything, for pathology, pharmacology. For example, since we were talking about what else can they ask me, in this question about atrial fibrillation, they can ask you which of the following medications can you give this patient? And they wouldn't tell you, oh, metoprolol, because that's too easy, but they would tell you a medication that works on receptors that are present in the heart that activate cyclic GMP, blah, blah, blah. And that's what a beta blocker does. So then if you know how to translate what a beta blocker does, then you are able to pick that choice. And that's very important. Always be able to translate. Everything has a translation that becomes the word metoprolol, which is only one word, becomes one line of 10 words. Beta blocker that blocks the heart or decreases the chronotropic effect of the heart, things like that. Okay, so for step one, because it's the craziest of all the tests in my opinion, I made a list of the most important diseases that you have to know for most topics. So for biochem, you have to know every single one of these topics. This is not the V for Venezuela. This is supposed to be vitamin B12. Sorry about that mistake. But you do not want to go to the test without knowing everything there is about these diseases, because you will see after you come out from the step, you will realize that they will ask you the same disease 5 times. And you will notice in the test, you will see, like, you will say, they already asked me 3 things about NADPH oxidase deficiency. But in one, they can ask you, okay, the organisms are produce catalase. And the other one, they will ask you the enzyme that is deficient. In the other one, they will ask you the mutation. So there's a lot of things into these diseases that you have to know. So don't go to the test without knowing all these diseases, because these are good questions to get right, because there's a lot of information. If you go to the test knowing the details, then just here, you have guaranteed at least 20 questions that you can get right, and just one topic, which is biochem. I also made a list of the graphs that you have to know. All these graphs are from Kaplan. So you have to know action potentials of neurons and what happens when you increase sodium in the blood or when you decrease potassium in the blood. You have to know all the electrolyte changes and how they affect the membrane potential. And you have to know it in words, but you also have to know it in graph. So that one is this one here. You also have to know what happens with the cardiovascular system. You have to know what happens when you increase vascular resistance, or when you decrease it, or when you give a patient nitroglycerin, or when you give a patient epinephrine. So you have to know this graph too. And again, you have to know it in words, but you also have to know the graph and what happens. This one is probably the most important. This one are related to the heart. So you have to know what happens if they give you a patient. I can give you the patient with atrial fibrillation that we just talked about, and you expect a patient with atrial fibrillation to have decreased cardiac output. So one answer can be one of these graphs, and the cardiac output has to go down towards the right, because in atrial fibrillation, you're not contracting as much, so you expect it. So I just giving you like 5 examples of things they can ask you just from the same question. So that is the smart way to think. You have to think, and I promise you that will help you a lot, because from one question you're coming out with 5, 6 different answers. So you're covering every single angle. And that's what question writers are thinking about. Okay, how can I make this question different? What can I put in the choices that give a different angle? Because in sickle cell disease, they can ask you about the vaso-occlusive crisis. They can ask you about the genetics. They can ask you about the treatment. They can ask you a million things. So they're always looking for things that are not common. For example, a patient who only has sickle cell trait, they are not able to concentrate the urine. That is called isostenuria. So that's a very weird thing that we're not always thinking about in our mind. So we go to the test and they give us a picture of the bloodstream that shows the sickle cells. And then we go to the choices and it says vaso-occlusive crisis, dactylitis, the mutation of valine being replaced by the other one, glutamate, things like that. And one answer says isostenuria, or inability to concentrate the urine. And because you don't have that in your mind, you will never pick that choice, because that is not something that you are always reading in every book. And because sometimes when they give us picture, we get biased by the picture and we don't care about the vignette. So those are important things. For step, you have to know everything about the QRS, and this goes for step 1, 2, and 3. You have to know how long each interval lasts. When you see ST elevation, ST depression, those are bread and butter questions that we have to know, because if we don't know, these patients die. So from my experience, steps is always testing things that are going to kill the patient. So for example, that patient with atrial fibrillation, before you put that patient in anticoagulation, you have to know, you have to do PT, you have to do INR, you have to do things like that, and you have to ask for medical history, because you don't want to give this patient anticoagulation and he had some GI bleeding 2 days ago, or he had a stroke 2 days ago. So If it keeps the patient alive, it's a question in the step. That's a good way to think too. Other graph that you need to know for lung disease, obstructive versus restrictive, you have to know what is happening. You have to know what is happening in the graph, and you also have to know what is happening in words. So they will tell you, okay, the curve will move to the right, R for restrictive, and O left for obstructive. This graph is tricky because the zero starts here, far away. We're used to seeing the zero here. So in the step, they can change the axis if they want to. And they can change the number if they want to, because they're trying to see how focused you are and if you are really paying attention to everything. So always be aware in the step of the axis. Don't just memorize, okay, the letters are always in the X and the volume is always in the Y, because they can invert it. And that is very common, and it happened in my exam for this, for the vasodilation and for the venous return, preload and afterload. They can change it because here is cardiac output. So they can put it here and then the graph will be totally different. So practice it. It's very important. These are things. This graph is about osmolarity of the blood and what happens when you give saline to the patient, or if the patient is dehydrated. You have to know what's happening, and you have to know this graph. Every single graph is from Kaplan, and I pick on purpose all the graph from Kaplan so you guys can see that all the information is in one book. And everything they can ask you is in one book. You don't have to really go through a million books. This one I think I repeated. Okay, so physiology and pathology, you have to know everything. I said that at the beginning, because physiology and pathology are 70% of the exam. You will get random questions of biochemistry, random questions of anatomy, but the bulk of the exam is physiology and pathology. I know a lot of students who spend time trying to learn all these crazy diseases, but there's only gonna be one question about, I don't know, Arnold-Chiari malformation in the cerebellum. They will not ask you 100 questions like they can ask you about congestive heart failure or acute kidney injury, because those are things that you see every day. You may go your whole life without even seeing an Arnold-Chiari malformation. So don't waste your time trying to learn the crazy diseases, except for biochem, because biochem it's its own animal. You have to know biochem. But in neurology, if you're studying neurology, it's more important that you know your strokes and the brain functions and the circulation. Is more important than knowing, okay, which type of spina bifida give you also increase in alpha fetoprotein and acetylcholinesterase, because they can only ask you one question about that, but they can ask you a million questions about stroke. They can ask you a million questions about the parietal lobe controls this versus the frontal lobe controls that. So every time you're studying, and I personally did this, I always focus on the things that are bread and butter, the things that I know I will see. And I'm guessing that most of us already graduated from medical school in Venezuela, so take advantage of that, because you know what you see in the hospital. What you see there is the same that you see here. You always see diabetes, you always see heart problems, you always see smokers. So whatever you saw in Venezuela every day, you got to make sure you know it, because that's what they're going to ask you. I mean, I guarantee you know many of us in Venezuela or here saw the Arnold-Chiari malformation or things like that. So know what you need to know, which is the basics. Okay, so coming back to this language and being able to translate. So particularly in pathology, they're not going to tell you, they're going to give you a patient who has Lewy body dementia or Parkinson or anything that looks like one of those neurodegenerative disorders. But in the answer choice, it's too easy to say Lewy bodies. If they ask you which of the following would you find on biopsy, and they tell you Lewy body, everybody will get that question right. But the translation to Lewy body is aggregates of alpha-synuclein with intraneural inclusions, and they may mention tau protein. So this is what's important more than Lewy body. So make sure you know how to translate things. For example, arteriolosclerosis. We all know what that is. We all know it causes hypertension. You see it in hypertensive crisis, chronic hypertension, it affects the kidneys, it narrows the lumen of the blood vessels. We know those things because those are basic things. But then when they translate it, it becomes a pink amorphous homogeneous material that accumulates in the wall of small arteries. That's different. That sounds different. So make sure you are able to do that with mainly pathologic things like slides, what they look like in the microscope, and also with radiology. For things with radiology, they don't always are gonna tell you, oh, the guy has a pneumothorax, and you can see the decreased air pulmonary markings. They may tell you other things like the deviation of the mediastinum and things like that. So it's always important to know how to translate one word into a million words, because what the step wants is that you have no time to answer questions. So the longer the questions are and the longer the answer choices are, the more time you have to spend reading the question and picking an answer. So this is how you take one word into a million words, two words into 2 lines, and it's all the same. It all means the same. So always make sure that you are able to describe what you see. Don't just learn the name. Don't just learn, okay, tau protein. You have to know what a tau protein is. And that applies for everything, particularly for step 1. For pharmacology, in my exam, I didn't have more than 20 pharmacology questions, which I was surprised because you think pharmacology is high yield. But what made hard those 20 questions is that the questions were not only the mechanism of action, but also side effects. So, for example, coming back to that question with atrial fibrillation, I can tell you I started the patient on anticoagulation on warfarin, and then I can ask you which of the following side effects is possible or can develop in this patient. And it could be something like bleeding of the brain or bleeding of the GI tract or warfarin-induced skin necrosis, things like that. Same if it's heparin-induced thrombocytopenia, things like that. So they don't have to tell you the name of the drug. They can tell you the side effect of the drug. Which of the following side effects will be present in this patient if given that medication? So they're not going to tell you heparin, they're not going to tell you warfarin, they will give you the side effect. Or they can tell you the mechanism of action. Like, for example, warfarin decreases protein C and protein S before the coagulation factors, and protein C and protein S are anticoagulants. So that is the why. In the 4 Ws, that is the why you develop skin necrosis, because you are first depleting the anticoagulants. So if you deplete the anticoagulants, then you get into problems. And then the interactions. For step 2 and step 3, there's a lot of questions about interactions because in the United States, every patient is on a million medications. So you have to know your interactions. And a lot of patients are taking herbal medications that affect a lot of the anticoagulants. So know your interactions. Like, for example, one recent interaction that has come into the step is the interaction that PPIs like omeprazole decrease the effect of clopidogrel in patients who are being antiplatelet for MI. So that can be a question, but that's a fairly new side effect, so it's good to know. And I mean, it's not 100%, but it's out there in the research, so it can be a question. But always know your side effects. So general things for steps. And this one I used to tell my girlfriend all the time, who is also a doctor now, because she would read forums all the time and then get worried. So please do not go to forums. Don't go to student doctor network and things like that, because everybody in those forums get 290. I mean, I was depressed when I was reading these forums too. So don't do it, because it's really gonna hurt your self-esteem. Another thing that you need to know is genetics and immunology. The difference between a 230 and a 240 and a 250 and a 260 is 3 topics, which is genetics, immunology, and biostats. I went to all the steps without studying biostats because I knew I wasn't going to learn it. I suck at math, so I knew I wasn't going to have the time to do calculations. And I knew I really didn't want to put the time in the test because I'd rather learn other things and make sure I knew it so I got it right, and so that can cover biostatistics. So obviously don't do that. Don't do what I did, but it shows that if you learn what is important, you can sacrifice other things. And for me, it worked pretty good. So I didn't study any biostats for step 1, step 2, or 3. You would think that I would learn the lesson by step 2, but I didn't. So that's my next bullet point. For me, biostat was always a hit or miss. And I didn't sweat it because I knew I could either get it right or wrong. And if I got it right, I was lucky. And if I got it wrong, I already knew. So I focus on everything else. And this I've been talking about the whole night. You have to know everything that you can in detail, especially cardiology, pneumonology, and nephrology. You have to know everything there is about the diseases of those systems, including the physiology, pathology, everything. Another thing that I have discussed with students and with mates and other residents and things like that is that a lot of us work while we're studying for steps. I actually, for step 2, I was a bartender. So I would go to my rotations during the day and would go back home until like at 7 p.m. And then I would only have 2 hours and I had to go to the bar to bartend. So those days, instead of trying to do 120 questions, 3 blocks in 2 hours and not learn anything, what I would do is I would pick a topic, let's say rheumatoid arthritis, and I would study everything there is to know about that topic in those 2 hours, because I personally thought I would get more out of it studying one thing than trying to do 120 questions in 2 hours. I mean, there's no way you will learn anything in that short amount of time, and you are then just wasting questions and not learning everything. So for those who work and have a couple hours a day, it's really, really good to just grab a topic. Okay, today I'm going to learn about arthritis. And then you start comparing rheumatoid arthritis versus osteoarthritis. And you spend 2 hours just on that, and then you learn everything there is about it. And then you don't have to review it a million times. So when you have a short amount of time on your hands to study, it's better to pick one topic or 2 and memorize it and master it, and leave the question for when you have time. You need for one block 2-3 hours. So don't try to cram 3 blocks in 4 hours, because then you're just rushing. You want to do things with calm, you want to be relaxed, and you want to go step by step. When you start jumping too fast, that's when you start missing things. The biggest surprise in my step 1 is the amount of anatomy questions I had about female and male reproductive system, because from my experience and from the medical schools in the US that I've met people from, literally they don't teach this in anatomy class really well. They only give you like 1 lecture. Same with embryology. Embryology is 1 week before anatomy and that's it. So because the steps knows this, they ask you this. So I have at least 15 questions about anatomy related to everything of the female and male reproductive system and things from the pelvis. And from my experience, even going into surgery, I really have to learn this again, because it's tough. There's a lot of things going on in the pelvis and in the reproductive system to know everything. So I would recommend that you study this because you may see it. Another thing that I've been saying is that we think that more questions is more points when we study, and it's the same concept. You don't want to spend 2 hours to do 3 blocks because you're really not going to learn much from it. It's better to go one step at a time. So if you can only do 20 questions in one day, it's better that you do 20 questions and that you learn something, that you do 120 and don't learn anything or just learn a little. So the whole secret for STEP is the preparation. So if you learn how to prepare yourself in a way that is efficient for you, you will do fine, because we as doctors that we already graduated from Venezuela, well, not me, but you guys, you have seen this. So if you take the time just to refresh your memories and to bring back those days of medical school, you will get it right and you will do well because you even saw it in practice. One advantage that I've always thought that international medical graduates have over American graduates is that international medical graduates, you already did clinicals, you already did your rotation, glural, you already did a lot of clinicals. So, and this happened to me when I went to the test and I saw all these values, all these heart rate, blood pressure. I didn't know how to translate that into clinical content. Like the example I told you about pulmonary embolism, you have to have tachycardia. I didn't know that for step 1. So they could have been giving me a patient with a MI or with a pulmonary embolism and bradycardia, and I would pick that choice because I hadn't done my clinical rotation, so I didn't know how to translate those physical findings or things like that. So use the clinical experience on your advantage, because you would think, oh, but step 1 only tests basic science. But if you go to the questions, you see physical findings, you see labs. They tell you hematocrit, hemoglobin, things like that, that American students take their step in the second year of medical school. You have to take step 1 before you can even touch the hospital. So we in the US, we don't know how to use all the clinical information that you get for step 1, because step 1 is becoming more clinical every day. So use that on your for your advantage. Again, I already mentioned this, that there will be 3 or 4 topics about every question, like I just discussed everything about atrial fibrillation. Here are some examples of things that they can ask you. Another really good advice that I would give you is psychiatry. Psychiatry is very easy in the steps because they don't go into the details. You don't have to learn the DSM-5 to do well in psychiatry. For step 1 and step 2 and step 3, psychiatry is all about the times. Like, for example, the differential diagnosis of schizophrenia, schizotypal or schizoid or acute versus chronic. If you know your times, and for example, I forgot, but if it comes to my mind, I will let you know. But psychiatry is very good to help you do well. So put the time. You would think it's low yield. If you ask people around, they will say, oh, psychiatry is low yield. But it's so easy that it becomes high yield, because every psychiatry question that you get right is a point that somebody else may not get because they didn't put the time for it. So a really important advice is to put the time for psychiatry, because it's really simple. It's very straightforward. This one is a biggie. Don't stress about NBME scores. I always tell people this because when you do an NBME, and if you do the self-assessment, from UWorld, for example, you can notice the difference between the length of the questions. NBME questions are 2 or 3 lines. And then you go to step 1 and you find questions that are like 20 lines. So how do you expect NBME, which is 3 lines, to be a reflection of what step 1 is? I went to step 1, step 2, and step 3 without touching one NBME, because in Aruba, when I was in med school, they used to give us NBME questions for the exams in the school. And I learned that those questions are very short and is not representative. So I've seen so much people postpone their step. Oh, I'm gonna change it. I'm gonna do it in 2 months because I took a NBME and I didn't do good. And that is just gonna hurt you, because the more time you spend studying, the less time you're gonna study, the more you're gonna forget, and the less motivated you're gonna be. So please don't let NBME scores depress you or worry you. Like I said, I didn't do one exam to assess my knowledge for step 1 or 2 or 3. What I did was actually the UWorld self-assessment, because those questions are long and those questions are good compared to NBME. And if you guys want to do the test, you can do it. I'm not saying don't do NBMEs. I'm just saying don't let the score of those exams affect you, because they're not really that good. I did do UWorld self-assessment for step 2 and 3, and it's very helpful. And it really gives you good perspective. And the other good thing about the UWorld self-assessment is that you can see the answers and the explanations. There's people that do 10 NBMEs and you never know the explanations for the answers that you got right or wrong, because you only get the score. You never get the explanation. So I think it's pointless. But if you do them, don't let them affect you. Also, at least 1 or 2 weeks before you sit down in the test, go to the website, to the USMLE website, and they have the software that you can download to practice. And they have a question that is 150 questions. And you will be surprised that sometimes some of those questions are in the real exam. Obviously not the 150, but like 2 or 3. So always do the self-assessments for UWorld and the sample test in the USMLE website. On the exam day, please relax. I know it's hard to say, but you will learn after step 1 and you will get more relaxed as you go. But if you had the advantage of people helping you and giving you advice, take it. Unfortunately, every single step of my medical education and my exams and my applications, I had to do everything on my own, because my school didn't help me at all, and I didn't know really much people in my situation. So I had to learn everything on my own. So now that you guys are getting some help from people who already went through it, nobody will give you an advice to hurt you. So relaxing is very important. You want to go to the test first having confidence in what you have learned. And second, it's good to know that in the test you're gonna feel like you don't know nothing, but you actually do know a lot. Don't let the feeling of, oh my God, these questions are crazy, don't let it affect you, because the first block, if it's hard and you start letting it get into your mind, you still have another 7 blocks to go. So you don't wanna get stressed and get anxiety and a panic attack on your first block. You have to be mentally prepared to take the test. It's a long test and you want to be relaxed. Please don't get stressed in the first block, because it's not good. Also, if you read first aid, the first few pages where they describe what the USMLE is like, they will say something like that they only tell things that you are supposed to know and basic concepts. And always think about common diseases before going into the crazy diseases. You do not want to pick a thalassemia until you rule out iron deficiency anemia, for example, because iron deficiency anemia you see every day in clinic and in the hospital and everywhere. Thalassemia you don't see every day. So it's more likely, if you only go by statistics, it's more likely that the patient will have iron deficiency anemia over thalassemia. However, if they give you that the patient is from the Mediterranean, then maybe consider it a little more. But always pick or always think about common diseases before going crazy. about all these other diseases that you don't see every day. And the best advice, and I'm sure that everybody would tell you this, do not change answers, because this happened to me. When you change answers, you're going to think about that questions. If you change your answer in question number 2, you are going to be thinking about that question in question number 20, and you're going to go back from question number 20 to question number 2 to put the first answer that you pick. And then you go back to question 20 and you go to question 30, and then in question 30 you're still thinking about that answer, and then you go back again. So you are wasting both time and time, because what you put first, leave it. You don't want to be going back and forward, because time is money in this exam. Another advice on exam day is don't pick things randomly. I've seen people that have told me, oh, I picked this answer because I never read it before. And I just think that's crazy. Why would you pick something you never seen before if you never seen it before? Pick something that you have seen and that makes sense. Don't pick things that you never read in a book, because if it's not in one of those books, it's not going to be tested, because those books are made to teach you the things that are tested. So never pick random things that you never seen before, and always try to make sense out of everything. I feel like, well, I think if you know the 4 W's, the what, when, where, and why, you always are going to be able to come up to 2 answers out of the 5 or 6 that they give you in the step. You can always get to 2 answers, and then you pick the one that's best for you. Another thing is that, and I did this from step 1 to step 3, I always highlighted the question that they asked me. So, like for the one with atrophy relation, I will always highlight in every single question the last question, what they want me to answer. Because there's so many ways they can ask you a question that you don't want to overread through it. Because when we are rushing time, sometimes we're really quick. So for example, the example I have here below, and this is very helpful in step 2 and 3, because 99% of the questions start with this line, what is the next best, and then they ask something. So in step 2 and 3, and also do it for step 1, always highlight it, because sometimes they can ask you what is the best step in management. Management can be anything. Management can be IV fluids, X-ray, anything. But if they ask you what is the next best step in treatment, treatment is only treatment. A drug, a medication. Treatment cannot be an X-ray. So if you only overread the question because you're in a rush, then you may get the question wrong, not because you don't know it, but because you read the question wrong. So I always highlighted it, and it's very helpful. And I always went back to that question just to make sure, okay, are they asking me what I think they're asking me? Because the worst thing you can do on the exam day is to be answering what they're not asking you. That defeats the whole purpose. Regarding breaks, everybody's different. And a lot of people is always asking residents and interns, like, how did you do? Did you do 2 blocks and took a break? Or how did you divide your break? But from my experience, I never planned when to take a break. For my step 2, believe it or not, I did not take a break, because my first block I felt confident, then my second block I felt confident, my third block I felt confident. So I did the 8 blocks without taking a break, and I don't regret it. But for step 2, my first block, I missed a few questions. I didn't have time because I had some epidemiology questions that I was trying to answer. And I missed 4 questions. So on my first block, after 40 minutes, I decided to get out of the room to relax, because otherwise I would get stressed, which I just told you don't do. So take the breaks when you feel like you need it. And if you don't take a break, like I did for step 1, it's okay too. That doesn't make you better or worse or smart or not being good at test-taking strategies. Take your break when your body asks you for. You have to listen to your body. If you had to pee after the first block, Don't say, oh no, but I plan to take my test and my break on the third block. And then you spend 2 blocks with a full bladder holding all your muscles in your perineal area, and then you're gonna be distracted. So if you need to do something outside, take your break and come back. It's okay. I don't personally feel that that makes a difference if you are comfortable with your strategy. So that's what I have regarding the steps. Any other question that you guys may have, you can write me in the private on WhatsApp, or I can give you guys my email, or you can just let me know in the group. So moving on to research, everything else for now is pretty short. So I've seen people who go crazy about research. They think that if you don't do research, you're not gonna match, and if you do, you are going to match. But when I was actually doing research in Johns Hopkins, 2 of the interns for general surgery, they literally came straight from the Middle East. They were both from Pakistan, and they had never done any research in their life. And they matched in Johns Hopkins, but they all got like 260 in all steps. So the point being is, step is the most important thing that you can do for matching. Don't waste time doing research if that's gonna affect your step score. Because I did research with a program director for a general surgery program in Baltimore, in Sinai. And I spent 1 year doing research with her, and this year she didn't take me. And I did good. I published some papers. I did everything for her. I was her secretary, pretty much. And even though I did all that and published and everything, I would think she would take me, and she didn't take me. So, and she would tell me every time that research it doesn't matter, because when they're picking you for a residency program, they're picking you to take care of patients, not to take care of research. So everybody says that research is very important, but I've heard personally from program directors, and yes, it's good, it looks good, but it's not mandatory. You can match in your first choice in a top program without research, as long as your step scores are good. In the other hand, if your step scores are 210, you barely pass, then you must do research, because that's going to be what's going to balance your scores. So if you do well on steps, don't worry so much about research. But if you do decide to do research regardless, something that I've noticed that works is when you are sending emails to researchers and to advisors and to program directors or attendings, you have to know the way to word the email. Use the word volunteer. I guarantee you that anytime you use the word volunteer, you will get a reply, because who wouldn't love to have somebody in your lab for free? If I can have somebody to work in my lab and to collect blood and do samples and tests for free, you bet that I will take it, no matter who it is, even if they don't know anything, just because it's free. So if you write the word volunteer in your emails, you will get more replies than if you say, oh, I'm looking for a position and a J1 and a research position. Those are very tough things to do for programs. Programs don't want to waste their resources on things that they don't want, because if they want you, they would just pick you. So if you use the word volunteer, it goes a long way. And everything I did on research was volunteer. I didn't get $1. I didn't get anything. All I got from it was the check mark on the application when they were checking my application. And that's what research becomes at the end. It becomes a check mark in the list of things that you should have for the application. Also, in your emails, or when you call, or when you talk face-to-face with researchers or attendings or advisors, don't just say, oh, hey, can I do research with you? Because anybody wants to do research with anybody, but you look good if you have an idea, if you have a plan. For everything in medicine, you want to have a plan. You cannot go into the OR and operate a patient without having a plan in mind, because you're going to mess up the patient. So when you go to talk to somebody or when you send an email, you can say, I'm interested in conducting some research. I need an advisor. My interests are oncology. I'm interested in pancreatic cancer. I have an abstract or I have written about this. Have something to show that you actually are interested, because they know that we are looking for research not because we love research, but because we need it for steps and for applications, I mean. So they know this, but if you come to them and you have something written, I wrote an extra last year, or these are the topic I like, then you look different. You look like, oh, this guy really cares about pancreatic cancer, or this guy really is interested about ovarian cancer. So it's always good to have something ready, so when they reply, you look smart, you look organized, you look professional. Those are, in America, the manners that you have matter most than your grades and than everything. An educated person in America can achieve anything. So it's important to look professional and organized and all those American things. So always keep it in mind when you go for interviews and everything. Another good way to get involved into research is that every year there's Congress everywhere. There's always Congress going on everywhere. And because you guys are already doctors, if you want to present an extra or a poster in a presentation, in a conference, literally all you have to do is write about something that is interesting, that is well written, and you just have to send it. And if they accept it, there you go. Bingo, you have your presentation. And you can put in your curriculum and your application that you presented an abstract on this topic in this conference. And there's so many conferences around the US that if you apply to 100, I guarantee you, you will have at least one abstract by the time you apply. So I don't really know exactly how to look for conferences, but if you go to journals and you register, like let's say you register to the Green Journal of Internal Medicine or Annals of Surgery, whatever field you are interested in, you just create an account in a journal and they are going to bombard you with emails, because that's what society is today. You give your email to Walmart and they're going to send you a million emails. So the same way for journals. So it's a very easy way and it's a very good way to get involved in research. And the good thing is that a lot of time, if you get an abstract accepted to be presented in a conference, that is your bridge to actually then submit a full paper. So then you went from being an abstract to a full paper, and then if the full paper gets accepted, then bingo, another publication. So now you have two things to put in your CV. So a good way to get farther into journals and research is to do a presentation. So those are good ways to actually get involved into research. Don't think that research is all about spending 2 years in a lab, because it's not. I was 6 months in Johns Hopkins, and from those 6 months that I was in the lab, I got like 3 papers. So you don't have to spend 2 years of your life doing research to get some good research out there. Other important things about research is that it's good to know the scope that you can work on. You don't always have to work on a tumor marker to discover prostate cancer before it becomes grade 4 and all these biochemical things. There's a lot of things that you can write about. You can write papers about opinions, about PPIs or anything. There's a lot of things to write about, and that's the beauty of it, that you can write so many things that it's not that hard to get papers out there. So you can always pick a clinical topic. You can do a review of the literature, like if you have information or cases from Venezuela that you can write about. Oh, I saw a case of Arnold-Chiari malformation. Then use it and you can write a literature review, a review of the literature or a case report. And that's a paper, and if it got accepted, there you go. So don't only think that research is a laboratory with a pipette getting blood out of patients, because it's a lot more. So just explore the field. You have to explore the field. I have worked on research in the lab, but I've done some research outside the lab too. Clinical things like improving glucose values in patients before they go to the OR. And that is actually clinical research rather than basic sciences. And it's meaningful too, because if I discover that bringing the glucose down to a certain level give me better outcomes, that someday can become a guideline for pre-surgical patients, for example. So clinical medicine is very valued here in the US, so use it for your advantage too. For the match is actually not that bad, but there are some things that you really want to have before you apply and before September 15. And you want your ECFNG certificate before September 15. When you start looking for programs, when you start doing your list of the programs you are going to apply to, you're going to come across with programs that say we do not accept applications from people that don't have the ECFNG certificate. So you don't want to have that limitation, because if you apply to that program, they're not going to even look at your application because they like to see that you have other requirements. And ECFNG and AAMC and ERAS, they're literally going to send you a million emails of everything you have to do. So don't freak out regarding, okay, what do I have to do now? What do I have to submit now? What do I have to pay now? You will always be aware of everything. Also, make sure you have step 2, CS, because that's the only way program directors know we actually speak English, because that's the only way they are able to assess our clinical skills. So Americans have the luck that they can actually apply only with step 1, but they're American, they have green cards, they're here, and they went to really good American schools. So to them, it doesn't matter. They know they speak English and they have what it takes. But for us that we need visa and we need pretty much everything, it's good to show them that we know English. I applied to 3 specialties. I applied to general surgery, which is where I match, but I also applied to OB and internal medicine because it's better to match in something than not to match in anything. And the good thing about the US is that every specialty has specialties, and every specialty of the specialty has specialty. So if you want to do, for example, something surgical, which is what I wanted, you can literally get to the OR in any field that you apply to. You can do IM, then you can do cardiology, then you can do interventional cardiology. And you will be in the lab putting catheters and things like that every day of your life. And that's surgical. If you want to do surgery, you can do IM, you can do cardiology, and then you can become an electrophysiologist. And you will be also catheterizing patients. And there's plenty of surgical things for those who want surgery that are involved in the OR and procedures. And if you apply to multiple fields, make sure you have letter of recommendation from each field. Don't apply to surgery and OB if you only have letter of recommendation for IM, because obviously that won't go. And also keep in mind that I learned this from the program director I work with. We're at the bottom of the list. So every time we get program directors get application, they print them and they make a pile of applications that they read. They don't read them from the computer. And IMGs are always the last ones because they know the Americans have everything we need. They come from good schools that are here in America. They have green cards, so they're always going to be on the top of the list. After Americans who graduated in the US, come Americans who graduated outside. So that means IMGs with green cards. Then after that comes IMGs who did rotations here, like let's say me. And then comes IMGs who did everything somewhere else. So that's why scores become important, because the only thing that will take you from the bottom of the pile is the scores. You can have a million papers published, but if your scores are poor, you're still gonna go to the bottom of the pile. So it's very important to understand how the process works, especially for interviews, because program directors are not gonna give you interviews until they have exhausted their spots with Americans. So if they have 100 interview spots and they pick 90 Americans, but then the other Americans they see they don't like, that's when INGs come into play. So don't expect to apply September 15 and to have interviews September 16, because our applications are reviewed a little later on. So most of the interviews that we INGs are going to get are going to be sometime in October, November, December, and sometime even January. But I tell you this because you don't want to be panicking, because you can make the mistake of start calling every program that you apply to. And if that program by any chance had you in their list and they were going to give you an interview for November, and you start calling them or sending them emails, they may take you out of the list and not give you the interview. So you don't want to get to a point that you're desperate and you start calling everybody, and it becomes hurtful rather than helpful. So we have to be patient about the fact that we are IMGs. And once we understand that IMGs have some disadvantages, then we focus on scores. That's what we want. And also, we have to make sure that we get good letters of recommendation, because this is the only thing that tells program directors that we actually have some kind of experience in the US. I did 2 years of rotations here in America, and I still couldn't get a categorical application just because I need to do preliminary year for general surgery, so they can see that I have experience in the US, even though I did 2 years of clinical rotations here in the US. And when it comes to general surgery, 99% of the INGs are going to have to do preliminary year before they do or make it to categorical. So keep that in mind too, and apply to preliminary positions, because that's going to save your life and your match. IM has also some preliminary positions, so it's very good to apply to preliminary positions in internal medicine too. And there's also transitional year, and there's a lot of choices that they're good for us, because it helps us, it doesn't hurt us. Yes, we have to apply again the next year, but it's better to make it when you're inside than when you're outside. And for match, if you guys want, when the match gets closer, we can do another presentation with more details and questions you guys may have. But these are the main things that I thought you guys should be aware of, because these are the things that are going to get you stressed. And the whole process from going to step 1 to matching, it's at least 2 years. So you don't want to have your cortisol levels to the sky for 2 years, because it's hurtful. So the best advice I can give you is take everything with calm, breathe, relax, enjoy the process, and trust yourself. It's a process. Regarding the visa, there's only one advice I want to give you, because we come from Venezuela. So make sure you get the document. You only need one document from Venezuela, and it's called, I thought I put the name here. It's called the Statement of Need. Make sure you get that as soon as you know you match. If you knew you match on March 1st, go to Venezuela, do what you have to do, but get that document, because it takes time. Things in Venezuela are not easy, and I'm sure that's why we're all taking the steps. So you want to make sure you have that document, because what delays your visa application is not having this letter, because this letter is absolutely required for J1 visas only though. If you have H1, I really don't know the process, because what I have is a J1. So I asked for this letter like March 1st, March 5th, like 4 days after I knew I matched. And I got it on time. I got it a month after, and I was able to get the visa with no problem. People who ask for the letter late and don't get their documents early enough, may still be trying to get the visa. So you don't want to match and not make it to July 1st because of the visa. That's the last thing you want to do. And again, ECFNG and AAMC, they're going to email you pretty much everything you need to know. It's impossible not to know what we need to do for the match because you will be getting emails. And I think that's all I have. Oh, and again, relax. It's not that bad. I'm telling you, after 2 years of going through all the steps and now matching, I enjoy the process, and I know a lot of people said, oh my God, step 1 is really hard, step 2 is even harder, step 3 doesn't matter, they don't look at it, but don't listen to people who tell you these things. You have to listen to the good things that you hear. I mean, there's only 2 ways in life, good and bad. So if you start taking the bad things and you start putting in your mind that everything is hard, everything's gonna be hard. So from my side, I just want to tell you all that it's not that bad, and it's actually, it becomes easier as you go. So try to every day get a little better, more comfortable, and more relaxed. And that's all I have for you guys for today, and I hope you guys learned something. Please feel free to contact me in the group in private. I guess I can write my email in the chat because I didn't write it in the presentation. So let's see. And I'm still here, so if you guys have any question, just feel free to write it down, or the group works too. All right, are we good? Anytime. I really hope you guys learn some. I hope to be a resident with you guys one day. That should be the goal for all of us. All right, so I'm gonna call it a night. Just, you have my number in the group. Feel free to contact me anytime, and if you guys need help with any topic or anything, I can help you, and I can promise I can help you before July 1st, because after July 1st, I don't know what my life is going to be like. All right, good luck to everybody, and take care, guys.